Let's get into how functional medicine tests for gut dysfunction and some of the things that we use on a daily basis within our clinics. So, here's where functional medicine takes a completely different path than the conventional care approach. So, if you were to walk into your primary care office with gut complaints, they're probably going to, number one, want to do a colonoscopy, or maybe they're going to test for H. pylori, because those are the main big ones that they know what to do with. And so if those come back clear, then they're going to just tell you you're fine. But the truth is, you can have massive dysfunction at the microbiome, immune, or even that leaky gut level, and standard tests will miss it every time. So it all goes back to what we always talk about. You wouldn't go watch the first 5 minutes of a movie and then claim to, know whether or not you like that movie. You need more information. You need a bigger picture, right? And so that's what functional medicine does, is it gives us a bigger picture and a broader look at not just the symptoms, but the things at a microscopic level that could be dysfunctional or going wrong. And so let's talk about basically the main tests we will use to analyze the gut, decipher what's going on, obviously, and then that will guide us on how we can heal and fix it. And so number one is usually going to be a zonulin or intestinal permeability test. And I will tell you right now that 99% of the time, if I'm testing someone for this, I'm getting a positive leaky gut diagnosis. And it's because the symptoms of leaky gut are often so accurate that if somebody comes in and they're saying all these things, we run this test. It's really a confirmation, but it's going to obviously, number one, confirm it for us, but then allow us to make the right steps. And so we'll get into that here in a sec. But basically what that is zonulin is a protein that regulates those tight junctions in the gut and how close the cells are to each other, which again prevents that leakiness of things getting into the bloodstream. And so this test, it confirms whether or not someone has leaky gut. And so the next one we would look into, right? And often we're going to run these together. The intestinal permeability test is a serum test looking for those antibodies, but the next one is a stool analysis, a comprehensive stool analysis. This can measure bacterial balance. It can measure pathogenic organisms, parasites, yeast, and even viruses that could be in the stool or in the gut, right? And so it reports on short chain fatty acids as well. These are SCFAs, which are critical for gut and immune health.